Hello dear students, welcome back to your channel I Love Pharmacology. In today's session, let us learn about the succinylcholine. So we'll be learning about succinylcholine mechanism of action, their indications and adverse effects. So coming to the succinylcholine is basically a depolarizing neuromuscular blockers. So it is a depolarizing neuromuscular blockers. Mainly, it functions as a skeletal muscle relaxant. So succinylcholine is a skeletal muscle relaxant. Please remember, succinylcholine is a peripherally acting skeletal muscle relaxant. The mechanism of action is it acts by depolarizing the neuromuscular junction. So that's why they are called as depolarizing neuromuscular blockers. So coming to the mechanism of action, the succinylcholine binds to the nicotinic receptors. So it is a nicotinic receptor agonist. Please remember, it is a nicotinic receptor agonist. It binds to the nicotinic receptor at the muscle end plate. Please remember, succinylcholine is a nicotinic receptor agonist which binds to the nicotinic receptor at the muscle end plate of the neuromuscular junction. So after binding to the nicotinic receptor, it stimulates the nicotinic receptor to produce a persistent stimulation and depolarization at the muscle. So these persistent stimulation and depolarization of the muscle end plate will cause prevention of the contraction through acetylcholine. So thus there will be this succinylcholine will be preventing the stimulation of the contraction by acetylcholine. So once again I am going to repeat it. Succinylcholine is a nicotinic receptor agonist. It binds to the nicotinic receptor at the muscle end plate which is present at the neuromuscular junction. Thereby it will going to produce a persistent stimulation and depolarization of the muscle end plate. So following that, this succinylcholine will be preventing the stimulation of contraction by acetylcholine. So initially what happens is, so once it binds to the nicotinic receptors at the muscle end plate, there will be initial muscle contractions or fasciculation which occurs quickly. So this will be seen within the first 30 to 60 seconds and following which it can be masked by general anesthetics. So since succinylcholine is metabolized more slowly when compared with the acetylcholine, please remember, since succinylcholine is metabolized more slowly than the acetylcholine at the neuromuscular junction, the muscle cells will remain in a depolarized state. So because succinylcholine is slowly metabolized when compared to the acetylcholine, the succinylcholine will remain for a longer period of time and muscle cells will remain in a depolarized state. So it causes depolarizing block, or it is also called as phase 1 block. And usually this phase 1 block will be unresponsive to further stimulation, which results in the flaccid paralysis. So this will be seen after 5 to 10 minutes of administration of succinylcholine. So following that, what happens is the muscle cells will be repolarized. Muscle cells will repolarize with continuous long-term exposure. This will be seen after 45 to 60 minutes. So the muscle cells will repolarize with continuous long-term exposure. But please remember, however, they cannot depolarize again. They cannot depolarize again while succinylcholine is present. So following the initial stimulation, you will going to see contraction and fasciculation, following which, since it is metabolized more slowly at the neuromuscular junction, so muscle cells will remain in a depolarized state. So it is called as depolarizing or phase 1 block, and this phase 1 block is unresponsive to further stimulation, leading to flaccid paralysis. Whereas following which the muscle cells will repolarize with continuous long-term exposure to succinylcholine and they cannot depolarize again even in presence of succinylcholine. So therefore they remain unresponsive to acetylcholine. So this phase is called desensitizing. There will be receptor desensitizing, or it is called as the phase 2 blockade. So succinylcholine can produce phase 1 block as well as phase 2 block. Phase 1 is also called as depolarizing blockade. Phase 2 is due to the desensitizing. So if there is a acetylcholine esterase inhibition, so acetylcholine esterase inhibition will enhance the initial phase 1 block by succinylcholine, but the acetylcholine esterase inhibition can reverse the phase 2 block. So which is the example for acetylcholine esterase inhibition? So it is the neostigmine. So neostigmine is a anticholinesterase. So anticholinesterase will inhibit the acetylcholinesterase activity, thereby it enhances the initial phase 1 blockade, whereas it can reverse the phase 2 blockade. So next, coming to the pharmacological property of succinylcholine. Succinylcholine has got rapid onset as well as short duration of action. The reason being, it undergoes rapid hydrolysis by plasma and liver cholinesterase. So that's why it has got short duration of action as well as rapid onset of action. So if there is a reduced plasma cholinesterase synthesis, which happens in case of end-stage hepatic disease, or if there is a reduced activity following the use of irreversible acetylcholinesterase inhibitors, may increase the duration of action, of succinylcholine. So coming to the indications. So succinylcholine is used as an adjunct in surgical anesthesia, mainly to provide a muscle relaxation while using a lower levels of general anesthetics. So basically it is used to induce a brief period of paralysis in case of short surgical procedure, as well as to facilitate the intubation, like endotracheal intubation, as well as in case of bronchoscopy, esophagoscopy, etc. So coming to the adverse effect profile of the succinylcholine will cause post-operative muscle pain at higher doses. So post-operative muscle pain at higher doses is the most common adverse effect seen with succinylcholine post-operatively, as well as it can lead to hyperkalemia. So please remember, succinylcholine can lead to hyperkalemia, and these hyperkalemia can result from loss of tissue potassium during depolarization. So during depolarization, what happens is the sodium will enter, whereas potassium will be effluxed. So these potassium will cause hyperkalemia, and there is a risk of hyperkalemia is enhanced. In case of patient with burns, muscle trauma, as well as in case of spinal cord transaction. It can be life-threatening also. Hyperkalemia can be life-threatening. It can lead to cardiac arrest and circulatory collapse. So it can lead to prolonged paralysis, which results in succinylcholine apnea. So this occurs in case of smaller percentage of the individuals, 1 in 3,000, if they have a genetically atypical pseudocholinesterase. If there is a individual who are having atypical or abnormal pseudocholinesterase, will not be able to hydrolyze the succinylcholine. Thereby, it prolongs the duration of action. So in such individuals with atypical pseudocholinesterase, there will be prolonged paralysis which lead to apnea. So there will be on and off breathing, and also there will be difficulty in sleeping. It can also cause bradycardia from direct muscarinic cholineceptor stimulation. So it can cause bradycardia from direct muscarinic cholineceptor stimulation, which can be prevented by administration of the atropine. There can be increased intraocular pressure, which results from extraocular muscle contraction. So the use of succinylcholine is contraindicated for if there is any penetrating eye injuries, which can lead to increased intraocular pressure due to the contraction of the extraocular muscles. And succinylcholine can also produce increased intragastric pressure due to the fasciculation of abdominal muscles, and this can be very dangerous because of risk of aspiration. So please remember, adverse effect of succinylcholine is it produces post-operative pain. It can cause hyperkalemia. Hyperkalemia can lead to increased risk of arrhythmias as well as cardiac arrest, and it can cause prolonged paralysis, which lead to succinylcholine apnea if the individuals are having atypical pseudocholinesterase. It can cause bradycardia, which can be prevented by giving atropine. It can cause increased intraocular pressure due to the contraction of the extraocular muscles if there is a penetrating eye injuries. And also it can lead to increased intragastric pressure, and it can lead to aspiration. So malignant hyperthermia is one of the very important side effects encountered with succinylcholine. So please remember, this malignant hyperthermia risk increases whenever the succinylcholine is administered along with the general anesthetic, that is halothane. So it is very rare, but it will produce a potential fatal complication in susceptible individuals. So basically, malignant hyperthermia will have a rapid increase in muscle metabolism. So in case of malignant hyperthermia, you're going to see a rapid increase in the muscle metabolism. And this malignant hyperthermia is usually seen in individuals who are having mutations in the ryanodine receptors. So if there is a genetically predisposed mutation in the skeletal muscles, this will lead to calcium release. So genetically predisposed mutation in the skeletal muscle calcium release channels of sarcoplasmic reticulum. This will lead to increased in the calcium release. So basically the individuals will have a mutation in the ryanodine receptor RYR1. So in case of malignant hyperthermia is usually seen with succinylcholine whenever it is used along with the general anesthesia, that is halothane. So what are the early signs and late signs of malignant hyperthermia? So the early signs will be the tachycardia. Tachycardia is usually the first sign which you are going to encounter with malignant hyperthermia. It can lead to hypercarbia, increased in the carbon dioxide levels. So the expiratory carbon dioxide levels will be increased. You're going to see muscle rigidity. So the early signs will be the sinus tachycardia, hypercarbia, and muscle rigidity. The later signs will include hyperthermia, ventricular tachycardia, fibrillation, as well as myoglobinuria. So what is the drug of choice for treating malignant hyperthermia? So the drug of choice is the dantrolene sodium. Please remember, the drug of choice for treating malignant hyperthermia is dantrolene sodium, which is also a skeletal muscle relaxant which binds to the ryanodine receptor, RYR1 receptor, and it inhibits the release of calcium from sarcoplasmic reticulum. So whereas malignant hyperthermia is mainly due to the mutation in the ryanodine receptors leading to the increased calcium release. Whereas dantrolene is a skeletal muscle relaxant which binds to the RYR1 receptors and they inhibit the release of calcium from the sarcoplasmic reticulum. So please remember, the drug of choice for malignant hyperthermia is dantrolene sodium. So coming to the summary, the succinylcholine is a nicotine receptor agonist. Within 30 to 60 seconds, it produces the muscle fasciculation. Since it has got prolonged duration of action, since it is not metabolized as faster as acetylcholine, so succinylcholine will remain for prolonged time, and this prolonged time will lead to flaccid muscle paralysis due to the depolarization. So in next 5 to 10 minutes, it causes flaccid muscle paralysis because of the depolarization of the muscle end plate at the neuromuscular junction, which is also called as phase 1 block. Following which, in next 45 to 60 minutes, there will be repolarization or the phase 2 block. It is mainly due to desensitization. So this block can be overcome by giving a neostigmine, whereas neostigmine will increase the phase 1 block. So it has got rapid onset of action, short duration of action because it is rapidly hydrolyzed by the pseudocholinesterase, which is also called as butyrylcholinesterase, which is present in the liver as well as plasma. So adverse effect you should remember with respect to the succinylcholine is very, very important. It is succinylcholine apnea. If the persons who are having abnormal, please remember, if the person is having the abnormal or atypical atypical pseudocholinesterase. In such individuals, the succinylcholine will not be hydrolyzed and it increases the concentration of succinylcholine. Then it leads to the succinylcholine apnea. Due to the constant muscle relaxation, it can lead to succinylcholine apnea. How it can be reversed? By giving the fresh blood transfusion. It can be reversed by giving a fresh blood transfusion, where this fresh blood will contain the fresh pseudocholinesterase. So one more important side effects of succinylcholine is malignant hyperthermia, which is mainly due to the mutation in the RYR, that is ryanodine receptors, and drug of choice will be the dantrolene. And also you should remember the succinylcholine can increase potassium levels, hyperkalemia, which can predispose to arrhythmia. So you should be very careful. It can be treated with lignocaine. So this was about the class on succinylcholine. If you find this video useful, please do subscribe to my channel. I love pharmacology, and do not forget to share and hit the like button for more updates on pharmacology topics. Thank you.